How you doing? My name is Eric Albert, and I'm here to do my final presentation. The topic that I'll be covering today is observational status and patient satisfaction. The problem with observational status is some patients don't realize that they are not inpatient as when they are placed in observational status. They are actually outpatients. And this can impact how insurance covers them and what their financial obligations are. The problem with observational status is people don't know whether they're inpatient or outpatient. When you're placed in observational status, basically it means that the doctor has not had enough information or enough time to determine whether you need to be an inpatient or not. So it allows them to do some further testing while you stay in the hospital, but technically you're still an outpatient because you actually haven't been admitted to the hospital. Patients that stay overnight in the hospital could be considered outpatients if they are placed in observational status. The problem with that is inpatient status versus observational status affects insurance coverage and subsequently the out-of-pocket cost to patients. Patients are often unaware of their status and the financial ramifications that are associated with their status. And just the last note, as it states down there, that observational services are hospital outpatient services given to help the doctor decide if you need to be admitted as an inpatient or you could be discharged. This creates some confusion for patients because they're told that they're going to be staying in the hospital. And so in their mind, most of them believe that they are inpatient admissions, but that is not the case. This leads to a financial burden to patients that they are mostly unaware of, or just don't understand the difference between inpatient and outpatient coverage when pertaining to observational status. The copay for one outpatient service done in the hospital could cost more than the inpatient hospital deductible. So let's say somebody is admitted for chest pain in the hospital and they're placed under observational status. Sometimes stress tests, ultrasounds of the heart, echocardiograms of the heart can cost more than the deductible would cost for inpatient admission, simply just based on insurance coverage, mostly with Medicare and Medicaid. And this is confusing to the patients because, to their understanding, they were told that they need to stay in the hospital. So in their minds, they are inpatient patients. 26.6% of observation patients paid more than the inpatient deductible. This is from a study from 2015. Most of the time, patients are surprised when they get their bill because they were unaware that the charges from being in the hospital were not being covered or were being charged differently than they normally would if they were inpatient. Patients that stay in the hospital assume their insurance covers them as a patient until they get their bill. And that's one of the biggest problems, is that this is not being explained to patients thoroughly enough, so they are unaware of their financial burden until they are actually getting billed. Therefore, when the hospital bill arrives and indicates only partial coverage for outpatient charges, they are surprised with higher than expected out-of-pocket costs. So most of the time they are aware of their inpatient deductibles, but are unaware that they are being charged as an outpatient for the services that were provided in the hospital. And as we said before, that they're unaware of those charges until they actually receive their bill. A lot of hospitals and reimbursement rates, in particular to Medicare and Medicaid and Medicare services, has now become value-based healthcare, which basically means that hospitals get reimbursed less or more depending on their patient satisfaction scores. There are some of them out there. One of the big ones nowadays is the Press Ganey survey. And the observation status and dissatisfaction of the way people are being charged and not being explained to them whether they're inpatient or outpatient and what observational status means can affect patient satisfaction scores and ultimately how hospitals are getting reimbursed because of patients not being satisfied. This kind of just illustrates kind of what I just said, that the observational status and what we call our KPI satisfaction scores can be affected because of observational status. Hospitals often receive complaints about unexpected charges, and this often extends to lower scores than on their patient satisfaction surveys. Even patients who had a positive clinical experience in the ED, for instance, might change their minds about the encounter when their bill arrives. And this is important because it kind of illustrates that you can do everything right while you're in the ED, as far as the physician taking good care of the patient, providing, addressing all the patient's needs, the nurses meeting all their tasks in a timely manner, doing providing holistic care for patients, just kind of, they can have a pleasant experience while they're in the ED, but all that will change as soon as they get their bill and realize that they're being charged more than they expected. Surprise costs can lead to grievances and complaints about the quality of care rendered. Just furthermore kind of explains and illustrates that we can provide excellent patient care, but ultimately the way patients are getting billed and observational status can affect the way they think about their stay at the hospital. Here's some solutions that I came up with and were suggested by some of the articles that I read. One suggested that cap the out-of-pocket expense for observation status at the inpatient deductible amount. This is one of the best solutions that I think has been suggested, because this kind of leaves no surprises and still doesn't eliminate observational status. It still provides physicians with the ability to keep people in observation and still give them time to do further testing to figure out whether a patient needs to be an inpatient admission or could be discharged. And it leaves patients without the ability to be surprised, because you would still cap it at what their expected inpatient deductible is. One-time deductible for both inpatient, outpatient, and observation status. This kind of just puts a hard cap on everything and puts one deductible across the board, and so it doesn't matter what your status is. That would kind of be irrelevant to the patient and would just be more of a technicality, formality thing for insurances, hospital administrators, and physicians. Create more comprehensive and accessible follow-up care to help reduce the need for observation admissions. This is a strong suggestion too. It kind of hits two birds with one stone, to be honest. Patients can still stay in observation status and doesn't change, those kind of things, but would also improve outpatient care, which would be a secondary goal for this solution, where patients can get better follow-up care. This would also affect readmission rates, improves patient satisfaction, patients' quality of life outside the hospital, but in particular, or pertaining to observation status, it would just reduce the need for it. The fourth solution would be educate patients and explain in detail observational care and the financial effects of being placed in observation status to the patients. This is just something that should be done regardless whether it's a solution or if nothing changes. People need to understand what is being expected of them and their financial burdens. This regardless if observations changes, this is something that should be practiced. These are the references that I use to come up with the information pertaining to observation status, patient satisfaction scores, and the financial burden of on patients being placed in observational status. Overall, we just need to do a better job of explaining to patients what observational status is, the reasoning behind it, the financial burdens placed on them for being placed in observation status. In general, mostly just explain to them that even though they are staying in the hospital, they will be charged out of outpatient cost. We need to come up with a solution for this because it is affecting reimbursement rates, putting a financial burden onto patients unexpectedly, and just sometimes deters patients from wanting to stay in the hospital or even seek help because of the financial burden being placed on them. Thank you. I hope that this was insightful, and I hope that we can correct this problem in the future.